No, that's a popular misconception. That is a belief from the 1950s and 60s. No, you can actually have a whiplash motion which moves the head. And that movement causes the brain, I mean, it's floating in fluid, to slosh back and forth against the skull. So you can have what they call a coup contre coup, so basically hit it at the front, then hit it at the back. So no, just even neck movement, an abrupt movement can cause this. The best way to protect yourself is actually to have strong neck muscles. They know from a study done in the 80s, for instance, that study done at Syracuse University with Dr. Cantu, that the more they strengthened the neck of the football players, they decreased the number of concussions by 50%. It's an enormous amount. And yet it was ignored for decades. And yet we see exactly the same thing here. Even people who've had concussions, if you fix their neck and have it in really good shape, people can still have impact, but they don't necessarily get any concussion. The neck is the suspension for the brain. Well, I've always been a bit vocal on this because I found out over the last 30 years, I knew that the longer people rested and recovered and went without stimuli, the worse it was and the harder it was to get them better. And I've been preaching that for a very long time, but it fell on very deaf ears. The international consensus this year finally said that maybe 1 to 2 days. It finally recognized the obvious. And they say maybe 1 to 2 days, and then you should be going out for walks, just gentle exercise. Now they're saying it just because they've observed that people do get better, but let's think of it just from a logic, straight logic. So if the neck has to be injured if you get a concussion, you can't not have the neck involved, it's impossible. And if you stop a person moving, what do you think is going to happen to the neck? If it's injured, it's going to tighten. Not only does it tighten, but the longer you have the person doing this, just rest and recovery, it loses strength and endurance, which means it gets harder and harder to get people better. Well, if when you're moving, you're increasing the blood flow in the muscle. If you increase blood flow, muscles relax. And you're not allowing it to stay in one position where it just contracts harder and harder. So the increased blood flow and even the gentle movement is moving, stretching, increasing blood flow, and you don't lose the strength and endurance. So basically that person, the probability of recovery and rate of recovery is much, much better. CTE is chronic traumatic encephalopathy. Now, the individuals that they've noted get this get literally hundreds of concussive or subconcussive blows to the head. It isn't like it's 3 or 4 or 5. They're hundreds. And with the pro athletes, often thousands. So I think if you're talking someone having probably 10 concussions, the probability is very, very low. Now, you don't want to take the risk because you don't want to cause damage to the brain, but you most certainly, that shouldn't be part of the mind. Otherwise, the stress of that thought, and by the way, I get this constantly from people who've had 2 or 3 concussions, they're all sure that they're going to have dementia and deteriorate like the pro athletes. It's an enormous fear right now, which actually exacerbates the whole condition. So thanks again for watching Terry Talks today. Hopefully it's given you a few more answers, or at least made you think about things a bit differently. So thanks very much again.